Under the Speaker's announced policy on January the 18th, 2007, the gentleman from Michigan, Mr. Conyers, is recognized for 60 minutes as the designee of the Majority Leader.
Thank you, Mr. Speaker. I ask unanimous consent to revise and extend my remarks.
Without objection.
Mr. Speaker, we are in the midst of the Cover the Uninsured Week, and I rise to remind the Chamber of the worsening health care crisis that we faced as a nation and propose a solution to one of the biggest challenges of the 21st century facing us. Lack of health insurance often denies necessary medical care. 47 million Americans are uninsured. This problem is not limited to the poor or the unemployed. Researchers have estimated that about 4/5 of the uninsured are either employed or members of a family with an employed adult. As well, there are an additional 50 million Americans who are underinsured. That is, they have coverage that would not protect them from catastrophic medical expenses. Simply put, an increasing number of Americans lack adequate health insurance because they and their employers simply cannot afford it. Despite the challenges of the war in Iraq and the slumping economy, we all agree that the uninsured need to be covered. Even the health insurance companies have their own plan for covering the uninsured. I'm glad that we are on the same page after all these years. The real question we face is how do we go about covering the uninsured? And how do we ensure that every American has access to quality medical care when they need it? I strongly believe in a single-payer national health insurance, an approach that has been too often marginalized in debates on this issue, even though it has been successfully employed in almost every industrial nation except our own.